For this purpose, the body is divided into regions and standardized anatomical directional terms are used. For example, the directions left and right always refer to the patient's left and right. A universal reference when discussing human anatomy is called anatomic position. All descriptions of the body use anatomic position as their starting point. Anatomic position is a person standing, facing forward with palms forward. When describing locations on the body, you will use anatomic position as a reference even if your patient is not in this position himself. For example, your patient's face would be referred to as anterior, at the front, because the face is anterior in an anatomic position, even if the patient you are describing is lying down. The importance of always referring to this standardized position is that all healthcare providers everywhere will use the same anatomic starting point when describing the body and will understand each other's references. For direction and spatial relationships, we divide the body into planes. A plane is a flat surface, the kind that would be formed if you slice straight through a department store dummy or an imaginary human body. Cutting through from top to bottom, you could slice the body either into right and left halves or into front and back halves. Slicing the body down the middle to create two side-by-side halves would create sagittal or median planes. Slicing the body into two halves, front and back, would create frontal and coronal planes. Finally, slicing the body into two halves, top and bottom, would create transverse or horizontal planes. Note that although it is good to understand the meaning of terms referring to planes of the body, terms referring to planes are not usually used in communications among healthcare providers. The midline of the body is created by drawing an imaginary line down the center of the body, passing between the eyes and extending down through the umbilicus or navel. Refer again to figure 5.3. That's this picture up here. Slicing through the imaginary body at the midline divides the body into right and left halves. The term medial refers to a position closer to the midline with regard to anatomic position. The term lateral refers to a position farther away from the midline. For example, you would say the bridge of the nose is medial to the eyes. You can say that an arm has a medial side, one that is close to the body, and a lateral side, the outer arm, away from the body. The term bilateral refers to both sides of anything. Patients may have diminished lung sounds on both sides when you listen with a stethoscope. This would be reported as the patient has diminished lung sounds bilaterally. The term unilateral refers to one side. Uni was one back in the last page. The mid-axillary line extends vertically from the mid-armpit to the ankle. The anatomic term for the armpit is axilla, so mid-axillary means middle of the armpit. This line divides the body into front and back halves. The term for the front is anterior. The term for the back is posterior. For example, you would say, the patient has wounds to the posterior arm and the anterior thigh. A synonym for anterior is ventral, referring to the front of the body. A synonym for posterior is dorsal, referring to the back of the body or back of the hand or foot. Remember that these terms always reference anatomic position regardless of the current position of the patient. The terms superior and inferior refer to vertical or up and down directions. Superior means above. Inferior means below. An example of this would be, the nose is superior to the mouth. The terms proximal and distal are relative terms. Proximal means closer to the torso, or the torso is the trunk of the body, or the body without the head and extremities. Proximal means close to the torso. Distal means farther away from the torso. For example, think of an elbow. It is proximal to the hand because it is closer to the torso than the hand. The elbow is also distal to the shoulder, since the elbow is farther away from the torso than the shoulder. The terms are usually used when describing locations on extremities. For example, to be sure circulation has not been cut off after splinting an arm or a leg, you must feel for a distal pulse. This is a pulse found in an extremity, a pulse point that is farther away from the torso than the splint. When using relative terms such as proximal and distal, it is helpful to give a point of reference. For example, you might say a laceration is proximal to the elbow. In this case, the elbow is your point of reference. Two other terms you may sometimes hear are palmar, referring to the palm of the hand, or plantar, referring to the sole of the foot. The mid-clavicular line divides the chest into regions. It runs through the center of a clavicle, or collarbone, and extends inferiorly. Since there are two clavicles, there are two mid-clavicular lines. When you use a stethoscope to listen for breath sounds, you will place the stethoscope at the mid-clavicular lines to listen to each side of the chest and assess the function of both lungs. The abdomen is divided into 4 parts, or quadrants, by drawing horizontal and vertical lines through the navel. The abdominal quadrants are described as the right upper quadrant, the left upper quadrant, the right lower quadrant, and the left lower quadrant. These are often abbreviated as, respectively, RUQ, LUQ, RLQ, and LLQ. All of that's in this picture here. So these terms to review: palmar means referring to the palm of the hand, plantar referring to the sole of the foot, mid-clavicular, CLAVICULAR, mid-clavicular line, the line through the center of each clavicle. Abdominal quadrants, 4 divisions of the abdomen used to pinpoint the location of a pain or injury. The right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. Positional terms. 4 terms describe specific patient positions: supine, prone, recovery, and Fowler. A supine patient is lying on his back. A prone patient is lying on his abdomen. A person may also be lying on his side, a position traditionally called the recovery position. It is the preferred position for any unconscious, non-trauma patient because it is a position in which fluids or vomitus can drain from the mouth and be less likely to be aspirated, in other words, inhaled, into the lungs. Because the patient is lying on his side, this position is also called the lateral recumbent position. See Figure 6.5.6. When patients are transported on a stretcher, there are several positions that they may be placed in. In the Fowler position, the patient is seated. This is usually accomplished by raising the head end of the stretcher so the body is at a 45 to 60 degree angle. The patient may be sitting straight up or leaning slightly back. If leaning back in a semi-sitting position, this is sometimes called the semi-Fowler. In a Fowler position, the legs may be straight, out, or bent. We're going to read this green point of view section. I really thought that all of the chapters before the cool medical stuff was just fluff. You know, nice, but not important. I wanted to learn about oxygen and suction and trauma and defibrillation, not medical terminology. Whoa, was I wrong? One of my first calls was a transfer from the emergency department to a long-term facility. The hospital was busy. The nurse handed me these orders. Then she asked if I had any questions. I'm still not sure if I looked as pale as I felt. They stared at me until I took the orders and read them. They actually made sense, but only because my instructor made us pay attention to the medical terms. She said, "You can't be a professional unless you think and talk like one." If anyone ever tells you medical terminology isn't important, they are wrong. Way wrong. All right, going back to positional terms. Supine is lying on the back. Prone, lying face down. Recovery position is lying on the side, also called lateral recumbent position. And the Fowler position is a sitting position.